My name is Donna Antonucci, that's D-O-N-N-A-A-N-T-O-N-U-C-C-I. I'm a citizen of Hoboken and a taxpayer. I'm here to support the sale of the Hoboken University Medical Center to Bayonne. In 2006 and 2007, St. Mary's really wanted to sell the hospital, but they could not find a suitor. They were losing money consistently. They decided to close, and at the 11th hour, the city of Hoboken stepped in to back the hospital with a $51 million bond. This is the only municipal hospital in the state of New Jersey. They have been consistently losing money since the city has backed it. 2008, I believe it was $23 million. The losses continued in 2009, and I can only imagine that the losses have continued in 2010. I think that we need to sell the hospital. I've heard wonderful things about the stroke center, the maternity ward, and the emergency room. I would like to see the hospital continue. I understand that the Bayonne deal requires that the emergency room stay open for at least 7 years. I think that's a good guarantee, and that's plenty of time for the community to figure out how to support Bayonne in making it successful. We've heard many, many wonderful things said about Bayonne, and I think looking at what happened there is a terrific example of why this is a very good suitor. I understand that they're the only suitor that really had the cash to do this, so I think it would be foolish of us to pass this up. I also neglected to mention that the only reason why the hospital has been able to stay open since 2006, 2007 is because of special grants from the state, which I understand they're not available anymore. The hospital, I believe, will close from everything that I've heard at public meetings, and it would be foolish of us not to take this deal. In terms of the insurance companies and outside interests, I would like to say that I think that this is the only hospital that's backed by taxpayers, local taxpayers, and I think that the opinions and the wishes of the taxpayers of Hoboken and the citizens of Hoboken should go ahead of outside interests. I believe that a lot of the deals that were made with a lot of the insurance companies, they don't pay enough. They don't reimburse the hospital enough for their costs. And I think that that's one complicating factor as to why the hospital can't make its payments. And I think that there is reason to believe that better deals in terms of reimbursement to the hospital should be garnered, and I think privatizing would allow that, and I actually support that. So I'm asking you to support the deal with Bayonne, with Holdco, and please sell the hospital. Thank you.
I'm Dr. Frank Solano, that's F-R-A-N-K, Solano, S as in Sam, O-L-A-N-O. I'm the director of the Puerto Rican Family Institute, a health and social service organization in the city of Jersey City. PRFI, as we're known, had a 7-year-old productive partnership with Hoboken Medical Center, starting when it was St. Mary's Hospital to the present. We support the transfer of ownership to Holdco so as to keep the hospital open, providing vital and quality services to the community. PRFI and Hoboken University Medical Center have worked in areas of medicine and preventive medicine, including diabetes, mental health services, weight management, HIV and AIDS services, through the Ryan-wide network of providers. A successful network, may I say. I take pride in the fact that we have managed to contain the incidence of new AIDS cases in the county. In addition, Hoboken University Medical Center and PRFI have obtained a very competitive federal grant to work with teen fathers, Latino fathers, and couples who are facing distress in the relationship here in the county. I have been also very fortunate to be a community member at the Hospital Ethics Committee, working side by side with a talented group of staff members of the hospital. So I look forward to continue this relationship. Thank you.
The Horizon Blue Cross and the service that we as municipal workers, employees of the hospital, Board of Education, Housing Authority, Stevens, we all feel worried that they're not going to be honored. That's another issue we hope that's negotiated. I was talking to Mickey McCabe, and I hope Mickey's going to step up and help our ambulance corps. We need the help. But I'm asking, and I'm actually begging and hoping that you'll consider, when you're going to decide to terminate positions, what these people have sacrificed here that work in this facility. The doctors, the nurses have fought to keep this hospital going. They have sacrificed. and we hope that you will take this into consideration. It's a very important, it's an artery. I refer it a lot of times to St. Mary's for emotional reasons, but our SMH or HUMC, whatever you want to call it, is a key to this region. Not just as an emergency care facility, but as a full operating hospital with many young people that have decided to have their babies in our fine labor and delivery section of the hospital. So again, I ask on behalf of all the people that, obviously we know that this is the last formality, the last cog in the machine. I know we at the county level, we're not involved in the ongoing process. We hear different things, and we hope that we can all work together. It's beholden on you all to hopefully work with all of us at all levels of government. And we look forward to trying to alleviate this situation. And we all hope that we can work together. I know that I can be contacted anytime, day or night, if anything I could ever do. Good luck, and thank you.
Cumulative operating losses by the hospital in 2008 and 2009 exceeded $38 million, depleting resources and leaving the hospital in a very fragile state. Unaudited 2010 results show that the operating loss was reduced to $1.5 million, but a structural cash flow gap still remains. With limited capital access, the hospital has been dependent on various types of ongoing assistance from the state of New Jersey to remain in operation. Recognizing that this situation is unstable and that any further losses would jeopardize HUMC's ability to function as a going concern, the authority engaged special counsel and financial advisors to help assess HUMC's operations, financial health, and strategic alternatives. The outcome was a plan for an orderly sales process. That process was guided by four main objectives. One, maintain a full-service community hospital in Hoboken, New Jersey as an acute care facility. Two, relieve the city of Hoboken of its $52 million bond guarantee. Three, preserve the jobs of HUMC employees. And four, meet the goals of the Department of Health for the rationalization of healthcare delivery in Hudson County. The request for proposals was posted on the HUMC website in July of 2010 and was distributed to a list of more than 170 entities. By September 2010, 6 respondents signed a non-disclosure agreement and conducted due diligence on operational and financial data related to the hospital. The following criteria were used to evaluate each RFP response: the adherence to those objectives I just mentioned, the future plans for HUMC under new ownership, the total deal consideration, and the ability to close the sale transaction, including financing commitments and timing risks. After considering all of these factors for all of the 6 respondents, the authority unanimously voted to enter a contract with HUMC Holdco in April of this year because it was the only response which met all of the authority's objectives. The Holdco sale, which is the subject of this hearing, provides significant benefits to the healthcare delivery system in Hoboken and Hudson County. This transaction maintains a full-service acute care hospital in Hoboken. It provides ongoing crucial services to Hudson County's underprivileged population by continuing various clinics that would otherwise close. Future healthcare needs which Holdco intends to provide include an on-site long-term care and on-site assisted care facility, new medical office space, and suites for physicians. Finally, the transaction removes the financial uncertainty surrounding the hospital, assuring better patient care, and it relieves the city of the bond guarantee. For all these reasons, I respectfully and strongly ask you to approve the certificate of need application. Thank you.
We would like to see much stronger conditions placed since the asset purchase agreement, while everyone has referred to capital improvement, is not in any way guaranteed in that agreement of sale. We would like to see that a condition of the certificate of need, that the $25 million that's been bandied about is indeed guaranteed for capital improvement. This institution, I thought, after having sat through a financial review every month, had lost up to about $3 million a year. I'm very happy to hear from the accounting side that it's only 1.5. Perhaps we could get back some of the money we gave up last year. It is, however, whether it's 1.5 or 3 million, a viable and essential hospital. We saw nearly 50,000 uninsured patients in this institution in the last reported year, a minuscule price to pay for those in need of care. Most urban hospitals would gladly operate with such a small deficit, and I'm greatly concerned by the repeated assertions that if this deal does not get completed as it is structured right now, that this hospital will either file for bankruptcy or close. I think that that flies in the face of community needs. The city's $5 million reported surplus of revenue, and also in the face of this procedure. The whole idea of having a certificate of need review is so that things like that are not threatened and do not happen unless they're absolutely fiscally necessary. $1.5 million, unfortunately, in today's economy is a drop in a bucket for an acute care hospital to lose. We feel that that has undermined the community's faith in this institution's ability to deliver care to those who are vulnerable and need it. And we wish that the tactics of fear be put aside by everyone. We should be working together and not trying to frighten each other. We also are not opposed to tax relief, but tax relief at any price is not a good investment. The community has access to services, and we have jobs. Our members and the community need each other. The employees at Hoboken gave up $6 million in wages and benefits last year to help this hospital, this community, and thereby ourselves. Many of our members have served this hospital for more than 40 years. All of what we have cited puts service and sacrifice at risk unless the department mandates very stringent conditions for the continued existence of acute care well beyond 7 years in Hoboken. Thank you.
9/11, they brought all those people to the hospital. If that hospital closed, we're going to fight till the end. And all the people in Hoboken are going with us. And also, I hope you understand that we need a hospital. Thank you.